Hey everybody, Dr. Butler here today. I was hanging out in my office and I want to take a little time to show you guys a stretch that's great for relieving low back pain, especially that pain that kind of comes to the side of the low back, whether it's the left side or right side, into the hip, into their kind of what people call their hip joint or the sacroiliac joint. Okay, and this is a stretch I give lots of patients to do when they're coming in and we're treating their low back pain. And I just ask them, so I adjust them, and then I ask them to go home and work on this stretch to kind of get the muscles around the joints that we're working on to start stretching out the muscles, the ligaments, so we can get some better motion in that area. So this is it. It's really easy. What's great about this stretch is you can do it while you're sitting at your desk, or you can do it while you're watching TV, pretty much whenever. It's super easy. So say I want to stretch my right glute, right lower back. What I do is, so I'll sit in a chair, I'll sit up nice and straight, I'll bring my right leg up over my left knee. So my ankle is sitting right on top of my left knee, okay? And you want to try and get it, as flat as you can. If you're really tired or really in a lot of pain, you might be up here like this. And that's okay to start there, but we want to try and get it kind of flat there. Okay, so then once we get there, we want to straighten back up real nice. And then the key here is to kind of hinge forward at the hips. Okay, and I'm just reaching over, and I got to a point where I have a pretty nice stretch. I can feel a nice stretch in my glute right now, and then I'm just going to hold that. Right now I'm not getting a lot of stretch. I'm getting a little bit of stretch in the low back. I'm getting it mostly in the glute. If I want to get a little more in the low back, I might reach a little bit over to the side. And I'll feel that kind of move over into the side a little, into the low back a little more. Everyone's going to be a little different. Maybe it's a little stretch like that, and you'll feel it move into the lower back. So that's what this is for. And then, when we're stretching, stretching isn't about inducing pain. Okay, it's about trying to lengthen our muscles. So when you're doing a stretch, it doesn't have to hurt. We just want to get it to a point where we're feeling a stretch, and then we want to get to a point where we feel a nice stretch and then hold it. So just hold that stretch for a good 30 seconds to a minute. And what that does is when we hold a stretch for that long a time, it gives the muscles a chance to start letting go. Okay? So muscles contract together like this. They have these little filaments that come together and they get tighter and tighter. And then so the longer you hold the stretch, the longer you have for those muscles to start letting go. And then go. So a lot of people, they'll get into a stretch and they'll be kind of like, which, okay, fine, you're stretching, that's great. But if you want to have a more effective stretch, you just want to get into it and hold it and let those muscles lengthen over time, at least 30 seconds. And that's why yoga tends to be pretty effective, because people get into these yoga positions or stretches, and then they hold them for like forever. They'll just like lay there for minutes in this stretch or stand there. So that's all I have for you today. So you can do it on the other side too. It's kind of like a little figure four stretch. And it's a great way to stretch out the glutes and the lower back and get that area to loosen up a little bit, especially in between adjustments or if you're just feeling tight from sitting too much throughout the day. So I hope you found this helpful. I'm Dr. Butler, your Northwest Ohio chiropractor. If you like this, please share it with your friends and hit like. Have a good one. Thanks. Bye.